Good morning, everybody, and welcome to COVID-19 Talk. We were postponed a week due to the Veterans Day holiday, but we're back, and we're joined with our local health authorities. With Harris County, we have Dr. Janina White, and with the City of Houston, Dr. David Purse. We've got a great setup of questions for you today, thanks to the Rotary Club of Houston, and we will go ahead and start with this very first question. A judge overturned Texas's ban on mask mandates, saying it violated the rights of students with disabilities. What are the implications?
Well, I'll maybe start. I know it's still a legal dispute, and so I think those implications are going to show later.
Okay. Next question is your thoughts about the Houston ISD announcement that they will consider changing its mask mandate policy after the winter break.
So I'll take a stab at this, although Dr. White is our pediatrician and has done a lot more work with the schools. I'll take a little bit of stab and then she can correct me. I think what the question really is revolves on is, when is this thing starting to end, right? At some point, we won't be talking about mask mandates anymore, and because the situation is improving. And the situation currently in Houston is improving. However, we are seeing that in other areas of the world and other areas of the United States, in fact, the neighboring state of New Mexico, numbers are going up. So I think waiting until after the winter break is a prudent move to have the conversation, because the situation could be very different by then, and we'll see what they think. Dr. White?
I completely agree. I think we have watched our trends, and usually after we have holidays, we do see an uptake in cases. And again, we're talking about a dynamic situation, because really we're trying to make sure, even now we have the 5 to 11 are able to get vaccinated. So now with more people being vaccinated, and then of course people traveling through the holiday season, I think we're going to need more data to really know best as we resume activities right after the holiday.
Thank you. In Japan, everyone wears masks. If we didn't vaccinate anyone else, but all wore masks, would that significantly reduce the risk?
So I think it absolutely would significantly reduce the risk. And I think that the example of that is that last year we had basically no flu season whatsoever. The amount of vaccination for flu wasn't dramatically changed from previous years. And so it wasn't that everybody went and got vaccinated against flu, but everybody was wearing masks last year, and we had almost no flu. And I am like a viral magnet. I get 2 colds every year, and I didn't get a cold last year. So, respiratory illnesses, if everybody wears masks, then it really reduces the spread of respiratory illnesses. Absolutely.
Yeah, I agree. I think mitigation, it really is a holistic approach. And to your point, we didn't see a lot of flu, and now we're already seeing flu upticks in certain part of the country. And so that masking, to your point, you might not end up in the hospital, but I certainly don't like to miss work days. I certainly don't like to have missed school days. So I think, masks show us that it does reduce the risk, won't eliminate it, but it certainly does help.
Switching topics to transmission, Harris County new cases appeared to be decreasing. 14-day hospital usage is at 11.7 and needs to be less than 10% to get to the yellow level. What is the most important statistic to watch? Is it hospitalizations? Is that the only thing preventing another decrease to the threat level?
I mean, I actually think the trends that we look at are comprehensive. So it's hospitalization trends, hospital usage, case trends, positivity rate. I think all of them in collaborate, using them collectively to make a story and state the case. I know what we've seen with our hospital trends more recently is they've just been lagging, so what we call like a long tail. And that just really is showing us, individuals who often will end up being in the hospital. It's so unpredictable, but we're identifying that they stay in there a little bit longer than we would expect. And so again, it's almost that thought of what's the worst case and what if I do get sick? But what if you're in the hospital and you have a prolonged hospitalization? So to this person's question, all of those metrics kind of are important, but we're certainly surprised about how long that hospital tail is showing us and what kind of information is showing us.
Okay, looking at a map, it appears the states without mandates are looking better. Is that accurate?
So I don't think so. As I've looked at maps, I'm finding that when we look at well, first of all, I find it hard to find a map that talks about mandates, because there's different kinds of mandates. There's mask mandates, there's vaccine mandates, there's different mandates. So part of it goes to that. If anything, I'm finding that the states that have higher vaccination rates seem to be doing a little bit better, but let's face it, well, the percent difference between one state and another in the amount of people who are vaccinated is not huge. It's probably plus or minus 10% at most. But there is that leaning towards the states. And actually, if you look internationally, the countries that have more vaccination tend to do a little bit better. However, I say that, and then Germany right now, which has actually a fairly high vaccination rate in the 70%, is actually having a terrible wave going on right now. So I find it difficult to correlate mandates one way or the other with how well communities are doing in terms of vaccination or in terms of infection right now.
Hey, now we're going to be talking about one of the most important things that the city and everybody is working on, and that's the wastewater data. Does wastewater give any insight on Delta Plus, and what else do we know about it?
So I'll take this because this is a city project for the moment. But what we found is that we do look for Delta and Delta. We look for all the variants, all the known variants in the wastewater. What we're finding is it remains well over 90% Delta. We have found some Delta Plus, but doesn't seem to be taking off ahead of Delta. And as you remember, there's sort of this, one virus, it competes with the others. And that's why Delta overtook Alpha, for example, right? So we are seeing Delta Plus is in the community, but it's really not taking off with any concern. It's still predominantly just the regular old Delta. And the overall viral load in the wastewater continues to go down, but it's decreasing at less of a rate than it was before. So our rate of decrease has decreased quite a bit, and that makes me a little bit concerned about what might be coming.
Hey, here we go to vaccines and treatment. Pfizer asked the FDA to authorize boosters for all adults. The term booster, once again, is being used interchangeably with the third shot. Is this intentional?
I'll take that. And I know Dr. Peirce really eloquently spoke about it, I think a call or two ago. But the booster is the booster after someone's received their first and second dose, with the expectation that they have a normal immune system and your immune system just sort of wanes over time. That third dose for immunocompromised people was really if you received a first and second dose and you really didn't get a good boost, a good prime for that immunocompromised consideration, you got that third dose, but that wasn't a booster in the sense of we discussed boosters. And so, it's probably the way we initially started the conversation. And so you're right, we're trying to make sure people understand a booster is for those people then whose immune system has been primed after receiving a vaccine. You sort of wane over time and you're asked to get an extra little boost.
Okay, there we go.
I don't know if I said it the same way, Dr. Peirce. I mean, you said this so eloquent so many times, and I love your version as well.
No, I think you said it exactly right.
Okay. The next question is, have any vaccines received full FDA approval, or are they all still EUA, emergency use authorization? How long will it take vaccines under EUA to receive full approval? I'm trying to convince people still reluctant that they aren't still test subjects.
Yeah. So I'll take that. So the Pfizer vaccine has received full approval and is no longer under an EUA. The Moderna one is, there's a process, and I think that people need to understand that the process is very deliberate and it's very thorough And that's why it takes a while to get the full authorization. In fact, there's a process to get the emergency use authorization, which is not straightforward or simple or easy. They're very rigorous, and that's all to protect the public. And so Pfizer does have full does have full authorization. Moderna is still under, and Johnson & Johnson are still under the EUA, and it's a matter of time. What I've seen is that Moderna seems to lag behind Pfizer by a month or two in terms of these milestones, and so I expect we'll see something about Moderna in the near future.
Okay, thank you. FDA approved Pfizer EUA for 5+. What is the projection for what age groups will require boosters? I'm guessing for this age, the 5+ age group.
And I think we're still too early. We're still getting kids vaccinated. We really don't know what waning will look like in that age group, the 5 to 11. So I think we're just going to have to wait for more information to come.
Okay. Have you heard yet if the pro or con to COVID vaccination is impacting the flu shot?
So it's funny that somebody should ask that. We just talked about that this morning, and it's a little bit too early in the flu shot season to say. I'm hoping that the rhetoric about anti-vaccine does not negatively impact our flus, because remember, long before this, we still had about 35,000 to 50,000, depending on how you measure, not how you measure, but depending on what year it is. We still have tens of thousands of Americans who die from the flu every year, and those are predominantly elder folks who've got lots of medical problems and infants. And so, these are all preventable deaths. And so it's tragic when somebody dies of the flu. It's 100% preventable. Whoever died of the flu, somebody else infected them. Now, unintentionally for sure, but they were infected by somebody else.
We are in a global pandemic, but different countries have different rules. The UK initially only gave one shot to 16 to 17-year-olds, and now the regulatory agency MHRA is saying a second shot is encouraged. The UK government vaccine advisors say all over 40 should get a third shot. Austria ordered a nationwide lockdown for unvaccinated. What country has handled this the best? That's a lot of a question.
Yeah, and I actually think, it's almost, impossible to determine, because there's so many variables within countries that their border, other countries have different mitigation strategies. They were using different brand vaccines. They started the implementation with different ages and different priority groups. So I think what we're learning is we are watching and learning, to Dr. Purse's comment about, overseas in Germany, and we are watching countries. We're trying to understand some of their practices to help, apply as best we can in our own country. But I think we still have to just continue those layering effects, the layering prevention methods, and really just stay focused on what we're doing here with regards to masking, really pushing vaccinations. And we're getting a lot of third dose considerations for vaccines, right? The booster vaccine. But we still have a lot of people who still need first and second dose. We're still trying to talk to those adolescents who still haven't gotten vaccinated. There's a lot of kids coming home for Thanksgiving and break and Christmas and the holidays. And so we really are trying to put efforts on what we know really does work, and vaccines work.
So yeah, I'm gonna add on. So, if you look at the international data, it would appear that some of the Pacific Island nations have probably handled it the best, but that's not because of the decisions they made. It's because they're island nations, right? And they have better control over who comes and goes, and they're generally smaller populations. So when you start looking at larger nations that have got land borders with others, there's a tremendous amount of politics have come involved. There's culture issues. There's trust or distrust of the government that comes into it. There's trust or distrust of science that comes into it. And this is part of the reason I think why some nations have managed it differently from others. But one thing I will say is I think that the United States, which has 4% of the world's population and over 15% of the world's deaths, has probably managed it among the worst nations, any way you slice it.
So does anybody have the latest information on Merck's molnupiravir and or Pfizer's Paxlovid? Did I get that right at all?
Yeah, I'm not sure. It sounded right, but I'm not sure if that's the actual way.
Confidence is all it takes.
we always wonder how these names come to fruition because they're always very interesting. And I'm still looking at the information, and we're, one of the things I think we're excited about in, public health certainly wants to think about the larger group and the public, but it's always nice to see other strategies which are treatment. So we had monoclonals, now we're hearing about these treatment options. Certainly we're not asking individuals to just use treatment as the only method. We want you to do prevention. But if you've done everything, you've done the prevention, and you're still finding yourself in these situations, it's going to be nice. It'll be a game changer that medications will also be coming on the horizon pretty soon.
Yeah. The only thing I would add to that, and it was in your message, Dr. White, but the best thing to do is get vaccinated, to not get sick in the first place. So the monoclonals, whether they be by injection or the new pills that are coming out, those are, first of all, those are all under EUAs right now. So for those folks who didn't want to get vaccinated because it was under an emergency use authorization, well, these pills are still under, and these therapies are under emergency use authorization as well because they're new. But the best bet is to get vaccinated and prevent the illness in the first place. That's your best bet.
Agreed. So an older teen typically gets a third HPV shot rather than just two. Is this similar to the protection of 2 COVID shots for young people and lower doses for the 5 to 11-year-olds?
I mean, I think they're just still asking that whole priming kind of concept. And so certainly that's kind of the intent. You get a dose, your system kind of primes itself, and then you come behind it sometime later and you get a booster.
Several snow leopards in a Nebraska zoo have died, and the NPR says there is evidence that SARS-CoV-2 spreads explosively in American white-tailed deer, suggesting the animals could carry the virus indefinitely and spread it back to humans periodically. How could this have spread?
Yeah, so I'll take that one. So we are, if you remember back, even in the beginning, we did see some spread of SARS-CoV-2 to primates, monkeys and gorillas, and we saw some to some cats. And there was a lot of talk about some domestic cats and some domestic dogs. Now that hasn't turned out to be a huge problem. There are case reports of that having happened, but we are now seeing that some of these larger cats in the zoos, and there's several examples, not just the snow leopards, but there's also some tigers and some lions that have become infected. And that's tragic. These 3 rare snow leopards that died it's tragic. And they got intense attention from veterinarians at the zoo. But it does raise the question, and then can the virus become, can wild animals, mammals in particular, become a reservoir for the virus? And this is what the white-tailed deer population raises, and it has exploded quite. If you look at the numbers, there's been huge explosions in the numbers of deer. And so can it become a reservoir to reinfect humans in the future? And the answer is yes, it can. It is not common that we've got illnesses in animals that the average person worries about, other than something like rabies, which is really rare. But for the hunters, if the deer population across the United States becomes predominantly infected, then every deer season, that this could be a major issue. And it would the transmission would predominantly likely occur in the preparing of the animal to harvest the meat. I don't know if, I would anticipate, but I don't know that in preparing the venison for, consumption at the dinner table, if that will kill the virus and make it safe to eat. I don't know that yet. I would assume that it would be helpful if it's cooked well, but I don't know. I mean, if you cook it and it's rare, I don't know. We'll have to find out. But yeah, this could be another problem with this virus. And remember, I've said this before, this virus is breaking all the rules when it comes to viruses. Every single thing that we've assumed about viral transmission and viral behavior, this virus is completely rewriting the rule book. And here's another example.
Yeah.
What surprises are in store for us, I guess, is the question. What is the treatment if you happen to have property with deer? Is there a possibility of contamination in the deer meat? And I guess you just answered that. But since we're almost done with these questions, I just had a couple. Number one is, now that we have the children 5 and up that are eligible for the Pfizer vaccine, Dr. White, what are you telling parents with people who may have questions?
So one of the things is just having those intimate conversations with parents. As a pediatrician, and I've talked to a lot of pediatricians, we're excited to have these conversations. Vaccine conversations were nothing that we're not accustomed to. We know how to take our time. We layered into your child's normal prevention visit. So it's just, for us, it's, I'll personally say it's a fun conversation because it means that our parents, our family members, they are engaged with wanting to have like information. And then we feel like when we give you information and we've answered your questions, it really makes you more confident that the decision you're making, is the best decision for you and your child. So these are conversations we've been having for years and we love it. So please reach out to your healthcare provider. Don't feel like it's no question is too stupid. Take your time. And I will say a plug out to, nurses in our offices. They know how to give vaccines. They're very confident. They know how to work with your child and anxiety. So don't have a sense of an anxiety provoking moment. Nurses, the medical assistants, our teams that give vaccines, they know how to do this and they enjoy it. They enjoy talking to children and making children feel comfortable and safe.
Okay, so Thanksgiving dinner is a week from today. What should people know when if they're planning to spend time with family from out of town, or even just, maybe people are having friends Thanksgivings? What are the ground rules this year?
I'll say one of mine and Dr. Purse, ground rule for me will be to know your vaccination status. I want you vaccinated, and I've been walking around, and of course, where is it right this moment? Oh, and even indoors, we will probably be indoors. We'll probably sit outside for some time, but when we're indoors, people need to have their masks because, again, you're vaccinated, but there still are some risks. So we're going to have good ventilation, but masks will be an indoor must as well, at least for the people we're associating with. So Dr. Purse, I don't know if you.
Yeah. So in my house, we're going to do it just a little bit different. So we know that with whom we're anticipating coming to Thanksgiving dinner at this point, they will all be vaccinated, and we're probably going to have our Thanksgiving outdoors in the backyard. And that's what we did last year. And outdoors in the backyard, we're not going to wear a mask. If the weather's bad and we're inside, because it's going to be a really small group, and I know that everyone is vaccinated, so we may not wear the mask indoors. But I'm talking less than 10 people, and we know that they're all vaccinated. So now there is a chance that we may have some little ones coming who'll be too young. That will then probably have to change our strategy. But I would advise people, don't drop your guard. Okay, do not drop your guard. It's too early to drop your guard, especially if you have someone in your household who is at risk, somebody who's got one of the risk factors. And the Houston Health Department just put out yesterday that of the people in Houston who died, slightly over 50% of them were diabetic. And just under 50%, or right around 50%, had heart disease. And so folks in your family, it's not just the elderly. I think we've had this sort of misconception across the community that it's just the elderly nursing home patient. No, it's not just the elderly nursing home patient who's died. We've got a lot of 40, 50, 6-year-olds who are gainful. I'm in my 60s, right? I don't want to die. So I'm not an 80-year-old nursing home patient with dementia, which I don't know why that's okay either. But somehow in society, we've sort of decided that those old nursing home patients, it's okay for them to die. Well, that's not who's dying anymore. Who's dying now are moms and dads, aunts and uncles. And we can't drop our guard yet, not just yet.
Okay, speaking of that Thanksgiving dinner, whether it's inside with a mask or outside with Dr. Purse, if you did get some questions about if you were invited someone that said they haven't been vaccinated, how would you talk to your friends about possibly, maybe this is you're in and you've invited someone, they're not vaccinated, and this is your opportunity. What should people say?
That's a hard one. I'll spare Dr. White having to go first on this. That's a tough question. That goes to a lot of family dynamics, right? And interactions. And if you've got somebody who, isn't vaccinated and won't be vaccinated, you probably also have some sort of ideas of what their behavior has been in terms of, are they going to crowded places or not? And that person, they pose a potential risk. Remember, 40% of the people who are infected have no symptoms. Also remember that right now we're looking at a slightly less than 5% positivity rate in the city of Houston. That's still 1 out of 20 people are infected. And if you look at the Texas Medical Center, they're looking at it's around 3%. Now, the Texas Medical Center is testing people who are preparing to have some sort of an elective procedure. They're going to get their knee scoped. They're going to get a colonoscopy. They're going to get, their tonsils taken out, whatever it is. These are people who are not symptomatic, and there's still 3% of them are coming back positive, and they are shocked to find out that they're positive, and they're upset because that now delays the procedure that they were going to have done. But so the unvaccinated, and in that Texas Medical Center group, a lot of those people are vaccinated. Right. So the ones that are testing positive are probably, the TMC isn't reporting this, but they're probably the unvaccinated. So amongst the unvaccinated people, the risk is much greater. And again, if you look at the people who are currently hospitalized, over 90% of them, no matter what hospital you ask, 90% or more of them are unvaccinated. So the unvaccinated person, I'm sorry, they just pose a risk. And then you may be the mindset that, but I am vaccinated. So if I have a family member over who's unvaccinated, but I'm vaccinated, so I'm okay. Well, we are having some breakthrough cases. And most vaccinated people who are breakthrough cases are getting through it, except if you're somebody who's got all the underlying risk factors: diabetes, obesity, heart disease, respiratory illness, blood problems, immune system problems. There are still people who are vaccinated. I said over 90% of the folks who are hospitalized are unvaccinated. Well, almost 10% of the people hospitalized were vaccinated, and they got infected by somebody else and still wound up in the hospital.
And Morgan, I think Dr. Peirce's discussion is a great point. Don't underestimate testing. So then people probably need to think about, the city has opportunities, the county has opportunities. This may be a good time for you to consider, I want to get tested. I'm not tested in a while, regardless of your status, test. And also remember, and if you have symptoms, don't just count it as allergies. Oh, I live in the Houston area. I think I'm just having allergies. Please get tested because, if you were to be positive, again, you now need to make different decisions. And if you actually get positive and you've been around someone who actually has been diagnosed with COVID, then we're still asking you to do those same things of quarantining. So testing has a role right now, too, for people as you start to think about gathering. Think about getting tested.
Okay, before we wrap this up, speaking of all this Thanksgiving talk, let's hear your favorite Thanksgiving dinner food item. Dr. White, you're first.
Ooh, favorite is stuffing or dressing and string beans.
All right, Dr. Peirce, you're up next.
Yeah, I'm pretty boring. It's the mashed potatoes with gravy and the turkey. But my wife's mashed potatoes and gravy and turkey, not just anybody's. Gotta be my wife's.
Gotta be. And I would say I would agree. I think the mashed potatoes and my Aunt Berta's rolls. That's what I look forward to all year round. Okay, we're going to wrap this up for now. We hope you join us in a couple of weeks for the next COVID-19 talks. Thank you so much to Harris County's Dr. Janina White and the Houston Health Authority, Dr. David Peirce. I have been your fill-in host today, Morgan Ash with the Houston Health Department. We want to thank the Rotary Club of Houston and past president Kathleen Bittiger. Hope everybody has a great rest of your week and an excellent Thanksgiving.